Welcome to the Wow MD podcast, where in each episode, you will get in 30 minutes or less valuable pearls about holistic wellness, anti-aging, hormone therapies, beauty trends, and other facts you should know about our medical healthcare system and your health that no one is telling you. My name is Dr. Mirala Chernayanu. I am a conventional board-certified OBGYN physician who, after the loss of my father due to a careless and uncaring medical team, decided to retrain and seek certification in anti-aging and restorative therapies. What I know, I am happy to share with you. Hello, dear listener, and welcome to part 2 of debunking the cholesterol secret and the myth of high cholesterol. In my previous episode last week, I talked about how essential cholesterol is for our well-being. And I really honestly don't want you to take away from my talk last week that having a cholesterol over 300 is necessarily okay. Everyone knows that high cholesterol is linked to cardiovascular risk. This is really all you hear when you go to see your cardiologist, how you need to get your blood pressure under control, and you have to have a better cholesterol number. That's all you hear. Therefore, everybody who leaves the cardiologist or the internal medicine office leaves with the blood pressure medication and a statin, maybe a diabetes medication on top of all that. But what the doctor does not have the time to tell you are some awesome, extraordinarily important statistics, which I'm going to share with you right now. I do want to start this episode with these statistics and actually discuss the risk for males after 50 for a coronary event based on their age. And I'm going to go by decade of age after 50. So at age 50 to 59, approximately 40 to 50% of males in this age group may have some degree of coronary artery disease, with coronary plaque being a major contributing factor. This is pretty high risk. If someone would tell you, hey there, you have a 50% chance of dying if you drive your car today, would you drive it? So let that sink in a little, please. 50%. At age 60 to 69, the risk for men increases further as age advances. Arterial stiffening and plaque accumulation are more prevalent, and around 60% of males will likely develop coronary artery disease, with plaque being a major factor in this progression. Age 70 to 79, males have an advanced risk. Risk factors for heart attack and death from heart disease compound due to the accumulating effects of age, long-term exposure to risk factors like alcohol, stress, poor food choices, sedentary lifestyle, smoking, exposure to toxins, or high cholesterol. The prevalence of cardiovascular disease in this age bracket, 70 to 79, can reach up to 70 to 75% in males. And coronary plaque, heart plaque, is very commonly found during diagnostic procedures, almost 80%. Age 80 and above is very, very high risk. This group exhibits the highest risk for major heart events due to the advanced state of arterial aging and plaque burden. Again, the prevalence of heart disease, of coronary heart disease, it's over 80%. So to summarize it, at age 50, you have a 50% chance as a male to have developed heart disease, and your risk goes up by 10% every decade. At age 60, you have a 60% chance of heart disease. At 70, your risk is 70%. And at 80, it's likely 80%. Now, here are some statistics you might have not known. And if you're a lady listening to this podcast, this applies to your men. Up to 50% of men experiencing a heart attack may not have previously recognized any symptoms whatsoever. A heart attack is their one and only symptoms. Some sources even suggest that a heart attack can be the initial manifestation of heart disease in a great majority of men, though percentages vary depending on the study population and who does the study and whatnot. However, what is more extraordinarily important is that about 50% of males who die of a heart attack experience death as the first sign with no prior symptoms. I'm going to repeat that. 50% of males who die from a heart attack experience death as the first sign with no previous symptoms. This means that half of the men who die from a heart condition have not been aware of their condition until it was too late to do anything about it. Now, you can stop me right here, pause me or stop me, and ponder about how important early detection and early intervention is of heart disease for our men. Now, in the last episode, I talked a lot about how important cholesterol is and how we don't want it too low. Well, what if it is too high? That's not good either. And everyone knows that treating high cholesterol often involves a combination of lifestyle changes and, if necessary, medications. But we always should try lifestyle changes first. Now, do not do what my husband said. I would rather eat pizza and take a statin. But instead, have an honest conversation with your doctor and your family about lifestyle changes, about what could be changed. And there will be no change if there is no support in your life. Maybe bring your wife along for the appointment. She will have to do the cooking in most cases anyway, right? So lifestyle changes that help your cholesterol would obviously be, number one, a healthy diet. Will have to be low in saturated fats and trans fats. You should eat plenty of foods like fruits, vegetables, whole grains, healthy fats, and healthy protein, like fish, nuts, avocado, olive oil, etc. So if you're going to have a nutritionist counseling you or helping you, you focus on your protein and complex carbs with healthy fats. Number two, we need exercise. We need exercise like we need water and food. So engage in regular physical activity. Aim for at least 60 minutes of moderate aerobic exercise daily or 45 minutes of vigorous exercise every day. Consider strength training, as your muscle mass and strength will determine how long you live and how you live in your old age, either weak on multiple medications with a busy weekly schedule of doctors and tests, or enjoying life, participating in hobbies, walking the dog, playing pickleball, gardening, etc. Number three, weight management is essential for healthy cholesterol. Losing excess weight can help lower cholesterol levels. Number four is consideration to toxins. That is what tobacco and excess alcohol are. Toxins. So quit smoking or vaping and consider moderating your alcohol intake. These two simple things can improve your good cholesterol, bring it up, your HDL, and avoid increasing your bad cholesterol. If you have high oxidized cholesterol, the inflamed cholesterol, and you gave it an honest try for 6 months with lifestyle changes, you ate great, you exercised well, you cut out all the toxin stuff, you addressed your stress, you balanced your hormones, and you have failed to reduce and improve your cholesterol profile, then you should discuss medications. You can also discuss medications as a bridge, low dose to get you to where you want to be, especially if you start with a cholesterol of 350 and a bad cholesterol of over 200. You don't want to give yourself 6 months of lifestyle changes because you might need to drop that inflamed cholesterol quickly, and a statin can help you get there quickly, avoiding the risk of, what did I just say earlier? Sudden death from an unknown heart disease. Of course, if you have high cholesterol that bad, you're probably going to need to do some calcium score testing and some other testing to detect heart plaque if you have it. We don't want to be caught by surprise. So what are the best medications to lower cholesterol? Top class of drug used by everyone is statins. They are the most common medication for reducing the bad cholesterol, or LDL, and have additional benefits for heart health according to all the studies that have used them. Number two are bile acid sequestrants. These help your body use cholesterol to make bile acids. It is literally shifting where cholesterol is used in the body, reducing the cholesterol levels overall. Now, think about if we only had similar drugs that would shift our cholesterol production into testosterone for men. Remember, I told you testosterone comes from cholesterol? Now, that would be a top seller. Another class of medications are cholesterol absorption inhibitors. They reduce the absorption of cholesterol from the diet. There's a niacin fibrates used in specific situations to manage cholesterol levels. And then the PCSK9 inhibitors. Those are newer drugs that can dramatically lower LDL cholesterol. You might have heard of Repatha, that is administered as an injection every 2 to 4 weeks. So let's go back and talk a little bit about statins. They're widely used to lower cholesterol levels and reduce the risk of cardiovascular disease, but like any medication, they have side effects. Let me reveal the top 10 major side effects that some people might experience. Number 1, muscle pain or weakness. This is the most commonly reported side effect. Patients may experience achy or tender muscle and even weakness, manifested as I can't open the can, or I can't lift that weight, or I can't reach overhead to do this, and the other. Number 2, liver damage. Statins can increase liver enzyme levels, which may indicate liver damage, so regular monitoring of liver function is often recommended. Number 3, digestive problems. Some people experience nausea, diarrhea, constipation, or bloating when they take a statin. And sometimes they're so upset digestive-wise by the statin, they stop taking it. Number 4, increased blood sugar levels. Interestingly enough, statins can raise blood sugar levels. That can be a concern for diabetic patients, and we need to keep watch over it. Number 5, this is a big one. And again, these are not in any specific order of importance, just as they came to me. Number 5, neurological effects. Memory loss or confusion has been reported in some cases, even though if it does happen, memory loss or confusion is generally rare and reversible. What's most common and what people complain about is foggy brain. Number 6, headaches. Some individuals can experience headaches while taking a statin. Number 7, sleep problems. Difficulty sleeping or experiencing nightmares can occur in some cases. So if you've been on that statin and for a while and you don't know why, you have difficulty sleeping or experiencing nightmares, maybe that's why. Number 8, rash or flushing. There are allergic reactions like skin rashes or flushing. They're not very common. They're pretty rare. Dizziness. In occasionally rare cases, some users have reported feeling dizzy. That can affect your balance and coordination and obviously might be a reason to discontinue the medication. Number 10, last, not necessarily least, but very rare, increased risk of myopathy or rhabdomyolysis. While extremely rare, severe muscle problems like rhabdomyolysis, where you have extensive muscle destruction of the muscle cells, muscle damage, it can occur and may also lead to kidney damage. So it is crucial for any individual taking a statin to communicate with their doctor any side effects they experience. Most doctors in the big pharma companies strongly believe and tout the fact that the benefits of statins in reducing heart disease risk often outweigh the risks of side effects. But each patient's situation is unique, and adjustments to the medication dosage might be necessary. Now, personally, I like to start with the lowest dose. Repeat cholesterol profile in 2 months. It does not take long for these medications to change things. A small dose could be just as effective as a higher dose. So I do not understand why doctors specifically start their patients on 40 milligrams or 80 milligrams of this or that or the other, the highest dose of that statin. And again, everybody responds differently. You're much more likely to have a side effect on a higher dose than a lower dose. Some people might be more sensitive. There really is no need for someone's cholesterol to be under 140, unless maybe they suffered a heart attack or have severe heart disease. Ideally, we want to shoot for cholesterol to be targeted between 160 and 180. Anything under 140 is too low, for my opinion. Now, I want to chat a little bit about why statins are believed to cause brain fog or cognitive issues, like memory loss, confusion. It happens in some people, though the side effect is supposed to be relatively rare. It does happen quite a bit. Now, the exact mechanism behind this foggy brain thing is not understood, but several explanations have been considered. Number 1, cholesterol is a crucial component of our brain cell membranes. If you don't remember, go back to my previous episode where I talked about cholesterol and how important it is. Cholesterol is involved in the formation of myelin, the protective sheath around nerve fibers. So some theories suggest that lowering cholesterol too much might interfere with these processes, therefore affecting cognitive function. This is in fact the number one reason people discontinue statins, not muscle pain. People put up with pain. We put up with pain, but they do not tolerate brain damage and feeling foggy. Number 2, CoQ10 depletion. Statins may lower the level of CoQ10, coenzyme Q10. This is a substance essential for energy production in the cells, including our brain cells. So we know that statins lower CoQ10. If you take a statin, you should be on CoQ10. So a deficiency in CoQ10 might lead to impaired brain function, resulting in symptoms like foggy thinking or memory issues. Number 3, we need cholesterol for making certain neurotransmitters in the brain, like serotonin. Reducing these neurotransmitters because we don't have enough cholesterol, because we took too much statin, might contribute to cognitive disturbances, including difficulty concentrating or processing information. We need our neurotransmitters and we need our cholesterol. Number 4, some research suggests statins might alter blood flow to certain brain areas, therefore affecting cognitive performance. And number 5, genetic factors and individual responses to medication likely will play an important role in why some people experience this side effect while others do not. So to conclude this discussion on cholesterol effects on the brain, the cognitive effects of statins are well documented. Obviously, we do need more research to understand the exact mechanism, what's happening, how we can prevent it. However, keep in mind that reports of memory issues of foggy brain have led the FDA to include warnings about these potential side effects. And unfortunately, many men and women are now reluctant to even start a statin due to this well-known potential side effect risk. I mean, who the heck wants something that damages or messes up with your brain? I know I wouldn't take it. I gotta tell you personally, I would rather give up pizza than take a statin, as I value and believe cholesterol, it's an essential vital molecule. So how can we naturally promote a good cholesterol profile other than using statins or other medications if lifestyle changes have failed to help us? Are there any vitamins or supplements that we could use to improve cholesterol? Well, yes, there are. I wouldn't be asking the questions if there aren't. Certain vitamins and nutrients can help improve cholesterol. Here are some you might want to consider. And again, there are no specific order, just as they came to me. It's not like some are more important than others. Number 1, soluble fiber. And we always kind of start with this one because we are naturally exposed and can eat a lot of fiber in foods like oats, beans, lentils, fruits, vegetables. And we know that soluble fiber can reduce the absorption of cholesterol into the bloodstream, helping lower bad cholesterol. So fiber is very important. Number 2, omega-3. Omega-3 fatty acids present in fish like salmon, mackerel, sardines, they don't necessarily lower the LDL cholesterol, but they have many heart benefits, including reducing blood pressure and reducing inflammation. So they help decrease oxidized cholesterol, the inflamed cholesterol, which is the bad cholesterol, right? Number 3, plant sterols and stanols are substances that are found in certain foods, fortified foods specifically, dietary supplements, and they can help block the absorption of cholesterol, just like the fiber did. Number 4, niacin. That's vitamin B3. It has been shown to increase HDL, our good cholesterol, while lowering LDL and triglycerides, the bad cholesterol. However, it should be taken under advisement, possibly with medical supervision, because it does have the potential side effect of flushing. Number 5 are polyunsaturated and monounsaturated fats. Replacing saturated fats with polyunsaturated fats, the ones found in nuts, in seeds, in fish and vegetable oils, or the monounsaturated fats like olive oil, avocados, and certain nuts can definitely help lower our LDL levels. Number 6 are antioxidants. Vitamins like vitamin E and vitamin C can prevent our cholesterol from oxidizing. And remember, it is the oxidized, inflamed cholesterol that is the enemy. The oxidizing of the cholesterol is a process that can and will lead to the buildup of plaque in the arteries. So taking antioxidants like vitamin E, vitamin C can definitely help that. Number 7, CoQ10. Coenzyme Q10 may support heart health and work alongside cholesterol medications. And I told you, if you're on a statin, you should be on CoQ10, especially because all the cholesterol medications deplete the body of CoQ10. You need extra CoQ10 when you're on a statin. So as a general recommendation, you need about 100 milligrams of CoQ10 for each medication that depletes the body of it. You're on a statin, a blood pressure medication, a diabetes medication, or ibuprofen medication, that's 400 milligrams of CoQ10 right there. Number 8, I love number 8. Garlic is well known to help reduce blood pressure and cholesterol. It does contain some active compounds called allicin and sulfur compounds that may inhibit the crucial enzyme required for cholesterol production. Also, the allicin in garlic may inhibit bad cholesterol, called LDL. It can prevent blood clots and reduce cardiovascular risk by inhibiting platelet aggregation. Remember, raw garlic might be more active than cooked garlic. Just brush your teeth after consuming it. According to some studies, garlic has the potential to reduce cholesterol by 30 points. Now, I found this recipe online that suggests soaking the garlic cloves in olive oil until it's very soft, and then spread it on foods as needed. Maybe toasted bread if you're not gluten-free, or find some nice gluten-free grain bread. That would be great. I'm getting hungry talking about it. I would be withholding valuable information if I didn't talk a little about arteriosil. This is a dietary supplement and the only one like it on the market. I put it at number 9 because I like it a lot and I think more doctors should talk about it. Even cardiologists should know about it and carry it in their office. This actually supports the endothelium glycocalyx. It protects and restores the health to the blood vessel wall itself. This supplement helps prevent the harmful particles of oxidized cholesterol and platelets from adhering to the blood vessel wall, creating plaque. What is it? It's a proprietary blend of seaweed, grapeseed extract, green tea, as well as many other fruits and vegetables. The main ingredient, however, is a specialized polysaccharide derived from the rare green seaweed called Monostroma nitidum. You don't have to remember that. It's just derived from seaweed. It's a powerful compound that helps regenerate our glycocalyx, the blood vessel wall lining. All the other ingredients in it are providing antioxidant support for the repair effect executed by the main ingredient. So they reduce oxidative stress. So we need all the other stuff as well. It's about $100 a month. I carry it in the practice because I believe in it. And I recommend checking a calcium score before using it and after 6 to 12 months of using it again to see if it's keeping things stable or improving your calcium score. Number 10, Reddish rice. Reddish rice contains substances that can lower cholesterol, but its use should be approached cautiously, especially if you plan to do it without supervision, because it can act similarly to statin drugs. A few words about reddish rice. You might not know that fermented reddish rice produces monocolin K, an identical molecule to lovastatin. This is an FDA-approved medication for lowering cholesterol. So because of the similarity of monocolin K to lovastatin, the FDA considers reddish rice products containing high levels of monocolin K to be unapproved new drugs. So it recommends against their use. Reddish rice supplements with the high levels of monocolin K have been linked to the severe consequences of statin drugs, like severe muscle breakdown called rhabdomyolysis, as well as kidney and liver damage. Now, the good news about reddish rice, it's been around for over 1,000 years. It is safe, but please remember that it is similar to a statin in its mechanism and side effects. So beware when you believe reddish rice is natural and better than statins. That's not necessarily true. Statins are synthetic derivatives of reddish rice. They're somewhat stolen from nature. It all started in the 1970s with a discovery by a Japanese microbiologist of a new natural product in the fermentation broth of a fungus. So yes, nature is always better, but Redis rice is not that natural. If you choose a supplement like Redis rice, understand a little bit more about it, its provenance, and how much monocolin K does it have in it, and consider the fact that it is similar to a statin, but most likely unregulated. I will end with a word of caution on supplements because we're talking about supplements to lower cholesterol. When considering supplements or dietary adjustments, it's very important to consult with a healthcare provider or at least a nutritionist that knows what you're doing. Any of these providers can provide some guidance tailored to your specific health needs. And a doctor, on top of this, can ensure that your supplements don't interfere with your other medications or conditions. So in conclusion, vitamins and supplements are useful in managing cholesterol, but they will not be useful without lifestyle changes like regular exercise, a balanced diet, stress reduction, and great optimal mental health and optimal mood. These are all integral in managing cholesterol levels effectively and optimally. Thank you for trusting me with your time, and thank you for listening to today's episode. If the content I provided wowed you, was helpful and valuable to either you or someone close to you, please do me a favor and leave me a review. I am very open and welcome any kind of feedback as well as suggestions on any content ideas, so please forward those suggestions to Jessica, my patient care coordinator, through our website, herabeautyandwellness.com. And I look forward to our time together next episode.